This is Molly, and this is our disease investigation project on tuberculosis. And my teammates are Samara, Caitlin, and Maya. Just for a quick overview of what TB exactly is, it is a contagious infectious disease due to the Mycobacterium tuberculosis. This bacterium affects the lungs of its host. You can see some of these bacterium as pink little rods in this photo below. There are two kinds of tuberculosis called latent TB and active TB. You can think of latent TB as the inactive form of tuberculosis, which means people who are exposed to latent TB will not contract it. Also, the infected individual with latent TB, as I said before, active TB does come with some signs and symptoms. Some of those signs and symptoms defined by the Mayo Clinic is coughing that lasts 3 or more weeks, coughing up blood, chest pain, pain when breathing or coughing, unintentional weight loss. The good news is that the United States has curbed its TB mortality and incidence rates over the past century. This is a histogram provided by the CDC of the reported TB cases and rates over the past 25 years. We can notice between the years 2017 and 2018, the CDC reported 196 incidences of TB within the population of North Carolina. North Carolina had about 1.9 cases per 100,000. Over the centuries, TB has estimated to have been responsible for 1.4 million deaths with its high mortality rate in the past. We can see that overall mortality rate and the number of deaths has gradually decreased as we move forward. The Mycobacterium tuberculosis is spread by small airborne droplets that are generated by coughing, sneezing, talking, or singing. These droplets can remain airborne for minutes to hours. The number of bacilli or bacteria in the droplets, the virulence, those who are at high risk for developing TB disease include people with HIV infection, people who became infected with TB bacteria in the last 2 years, babies and young children, people who inject illegal drugs, people who are sick. There are multiple ways to diagnose TB. One of them is a skin test. The TB skin test is performed by injecting a small amount of fluid called tuberculin into the skin into the lower part of the arm. The person who is given the skin test must return within 4 hours. Another method is a blood test. It's specifically called a interferon gamma release assays, or IGRAs, and it'll simply just detect if there's tuberculosis in the blood. There is no cure for tuberculosis, but it can be treated for both active and latent TB. Some of the treatments include isoniazid, rifampicin, pyrazimamide, and ethambutol. These are all medications that can be taken in combination. Healthy People 2020 set a target goal to reduce tuberculosis rates of new cases to 1.0 per 100,000 annually by the end of 2020. Healthy People 2020 also focused on increasing treatment completion rates of all tuberculosis patients who are eligible to complete therapy. In 2005, 81.9% of people with confirmed tuberculosis completed curative therapy. Current disease control methods include health specialists educating others on how to prevent sickness by preventing respiratory droplets being spread to others by simply covering your nose and mouth when you sneeze or cough.